Hello, my name is Alyssa Miller, and today I'm here to discuss nurse burnout, which is an important and rising topic in our healthcare system today. I will now begin explaining what nurse burnout is. Nurse burnout can occur when nurses become unmotivated to work due to stressful situations they may be put into. Nurse burnout can also be associated with mental health challenges as well, due to the job of being a nurse. French and Lassater 2022 claim our analysis of survey data collected December 2019 through February 2020 from 33,462 registered nurses in New York and Illinois revealed that more than 40% of RNs reported high burnout. As we reported recently in the Journal of Nursing Regulation, 1 in 4 were also dissatisfied with their job, and 1 in 5 planned to leave their employer within 1 year. 1 in 3 among nursing home RNs. In addition, over half, which is 56% of RNs, reported not having enough staff to get their work done. 68% rated care quality at their workplace as less than excellent, and 31% of hospital RNs gave their hospital an unfavorable patient safety rating. Nurse burnout can affect nurses in multiple ways. As such, mental health is challenged constantly in the career field involving medical care. It can be very troublesome coming to terms with patient deaths, having the stress that comes with trying to keep patients alive and well, especially when they may not have appropriate equipment ready and available. Short staffing, which means unsafe patient ratio assignments, and dealing with aggressive patients, which only makes sense how all of this can affect anyone's mental health. Landy 2022 expresses, along with increased stress, nurses are also fighting discrimination and assault on the front lines. 2/3 of nurses, 65%, report they have been verbally or physically assaulted by a patient or a patient's family member within the last year. Anger around hospital COVID-19 guidelines, 52%, and frustration around staffing care, 47%, were the contributing factors to this aggression. Paragraph 7. In the medical field, it is common for nurses to take on unsafe ratio assignments due to short staffing. When the COVID-19 pandemic went into effect in 2020, we were in dire need of nurses, so a lot of nurses took advantage of becoming travel nurses for higher pay compensation when traveling out of state. Though this was good for the hospitals, a lot of in-house nurses were not so happy with the paid travel nurses were receiving compared to the ones who had been there doing the same job. Davis 2022 explains an ongoing frustration for the nursing industry remains travel nurses. More than 75% of nurses surveyed reported seeing an increase in travel nurses in their unit during the past year, and 1/3 of those polled indicated that increase made them dissatisfied or extremely dissatisfied. Paragraph 7. In paragraph 8, Davis explains pay is at the heart of the issue, with 86% of the nurses reporting the compensation differences were the main cause of their dissatisfaction with travel nurses, who are often highly paid by temporary staffing agencies to solve critical gaps. When the question is asked, how does nurse burnout affect the community? The trouble of nurses becoming burnt out in their jobs, whether that may be taking breaks or leaving completely, this affects everyone else in our communities as well. Nurses are frontline workers, and usually the main people you see when you enter a hospital setting. Nurses and tech/CNAs, when available, are the ones primarily taking care of patients. So when we are critically short on nurses, that means we are short on people to take care of the ill. And what do we do then? Nurses are critical when staffing a hospital. You may ask yourself, where are nurses going? These days, it is common for nurses to leave bedside nursing. A lot of nurses get burnt out when taking care of patients at bedside because they begin to feel as though their jobs become more repetitive and sometimes not in a good way. Nursing is such a broadened job and can be easy to move around with the right skills. Most are able to find a specialty to their liking where they may find passion. Others may realize they are ready to retire from nursing, and they may leave the profession altogether. A survey based on why nurses may be leaving, Landy 2022 explains, the survey also found that 42% of nurses started a new nursing role since January 2021. The main reason they moved to a new role was higher pay. 58% reported this was their motivating factor. Other reasons for the change include a search for a different role, 33%, an improved schedule, 31%, their preferred location, 25%, career advancement or training opportunities, 24%, and better staffing overall, 24%. How are we helping bring new nurses in? Hughes 2022 explains, because our workforce is our most precious resource, hospitals and health systems are committed to supporting them. That's why we've created programs and developed resources to promote caregiver well-being and resiliency. Examples include helping to pay back student loans, providing childcare and transportation, offering tuition reimbursement and training benefits, providing referral and retention bonuses, and supporting programs that address mental and physical health. Paragraph 5. And in New Mexico, Hazenbach 2022, the New Mexico Nursing Education Consortium is a partnership of nursing education programs at all levels across New Mexico that aims to increase the number of nurses prepared with bachelor's and graduate degrees, improve the quality of nursing education, and increase access to these programs in rural communities. It enables nursing students to earn a Bachelor of Science in Nursing (BSN) degree from UNM by attending courses at community colleges or branch campuses across the state. Paragraph 1. How can we as a community help with nursing shortages? We may come to the conclusion of showing as much support to those that take care of the ill when possible, showing nurses appreciation by making sure they do not receive unsafe assignments, helping when possible, creating a safe space for talking when needed, and making sure they have all the equipment and support when caring for patients, and most of all, being appropriately compensated for all they do in our healthcare system. At some point in our lives, whether we like it or not, a nurse will take care of one of us or a family member.